Okay. So Chandra and Camilla, please join on with your camera. You, Shauna, looks like you're just joining in, so that's great. All right, so any questions about what we went through last week? It was kind of a review, expectations, things like that. Any questions on that? You should have gotten your group from an email. I sent out several emails this week. So we have our first exam on our first exam will be on next Tuesday, this time. Study guides are sent out in the email, so please make sure you check them. Print those out before you go to the review sessions. I also posted out, yes, Sandra, I see that. I don't know what's going on with your camera. If it doesn't sort of settle down, will you just join on your phone so that we don't have that? Because that'd be great, but don't worry, give it a couple minutes. So, and you should have your study guide ready to go. You should have your groups all organized. Like I said, Gull was adding to one and somebody else.
Elvira?
Yeah. Yeah. Thank you, Catherine. She joined your group or dropped out or something?
No, it's Abigail. She joined our group. Yeah.
Yeah, Abigail. Okay. Oh, thanks, Abigail. Sorry. Both of you guys were unmuted. All right, good. So she joined your group, so you know that. And Gull was joining the Nashville group as well. Okay, so if he was in your group, we're changing his group to group 1. Okay, so guys, get working because next week you have a group project. It's on I think it's next week. Yeah, I'm pretty sure. It's a discussion. So take a look at that. You guys need to get in touch with one another. All right, I'll take attendance real quickly. Like I said, Zoom is recording us, so it knows when cameras are on and cameras are off and when we're present and when we're not. So if you are not present on camera, you will get deductions on attendance. I just send the report to attendance and then they fill it out. So let's make sure that we all have our cameras on and we're ready to go. All right, let's take attendance real quickly. Ivana. There you are. Welcome. Camilla, I know I asked you to turn your camera on, so you're somewhere. Where are you?
I'm here.
There you are. Thank you. Stephen?
I'm here.
Mary?
I'm here.
Great. Elvira? No. Abigail? Thank you. Yushana?
Here.
Okay. Did I say that right?
Yes.
Great. All right. And then Sandra? I know you're here. Something's going on with your camera. You're fixing
I'm
that.
here. Yeah, I'm
Okay.
here. I'm working on it.
Thank you. Charity?
Yes,
And-
ma'am. I'm here.
Welcome. And then Ghoul, we have you switched for your group, okay? So get in contact with group number 1.
All right, thank you.
Sure. Don? No, Don. Chandra?
I think Don ended up having to not take this class this term. So I
Okay.
believe he's not in the class anymore.
Great, thank you. Chandra?
I'm here.
Jen? I saw
Here.
you, you're here. Sorry for all the confusion this week, huh?
Yeah, it's been awful.
I know. All right, so stay on with me at the end and we'll work everything out, okay?
Okay.
Let's see, Passion?
I'm here.
Welcome. And Bridget?
Here.
Awesome. And Jessica?
I'm here.
Great. All right, and Lindsay should be here.
Here.
And Yogesh.
I'm here.
Hi there. All right, guys, so good work this week. You got all your papers in on time. I really enjoyed reading about it. I thought it was interesting to see where everybody's coming from. We have a lot of LPNs in here, so that's helpful. A lot of goals were similar. You guys just want to finish up nursing school, and I don't blame you. I would be in the same position as you. So remember that we didn't, we are doing our very best. We're getting through it. Everybody should have seen in the announcements for this week, I did a lecture on topics for 1 and 2, week 1 and week 2. Catherine, I'm taking your attendance here. I don't know why you're not on my roster. So you guys should see those. They're about 25 minutes a piece. They'll probably get longer as time goes on. What I did really for this was I went through our PowerPoints for the chapters and I emphasized what I wanted you to know. So did everybody get a chance to see those? And they're under your announcements for week 1, you have your lecture, and week 2, you have your lecture under there. So make sure you guys are checking those out. Remember I said, excuse me, I still have this terrible cough, but what we're gonna do is not really lecture in this class, we're gonna do more interactive stuff. So that's why we're doing that lecture as a side piece as Dr. Brown's request. So about that, we covered several chapters these past 2 weeks. I hope everybody was comfortable. There's one topic I wanted to go over with everybody because you will need to know it for your test. And I don't feel like I covered it well in lecture. So we're going to take a look at something. It's prevention. And there's 3 different levels. Does anyone know the 3 levels?
Primary, secondary, tertiary.
Yep, good. So primary, secondary, and tertiary. And the thing to remember about it is as community nurses, we're trying our very best to keep our community healthy. Remember, we talked about community oriented, and that's on our another topic we'll discuss a little bit tonight. But so we're taking a look at and we're seeing our prevention levels. And I did a little PowerPoint, just 4 slides for you guys, because I wanted to show this to you. I feel like it's an important concept that I want to make sure that you are that you guys are familiar with. So here we go. When we look at our preventions, we have 3. We have primary, secondary, and tertiary. So when we get up to our primary prevention, this is where we're going to work with our patients, and we're going to try to prevent disease process so that we don't have any come on. And then we go to our secondary level, and that's where we're going to do our screenings. And we're going to try very hard to screen for those that may have disease process and make its complications minimal. And then we have our tertiary where you have something going on. Okay, so my definitions that I give to you is this, is that with our primary prevention, we're preventing the disease from happening. With our secondary, we're going to identify and stop a disease early on in our process before the patient even realizes anything is wrong. So we try to do this before we see any clinical symptoms arise. And then we have tertiary where our patients already have clinical sign of the disease. So when we're preventing, we're trying to decrease morbidity, decrease mortality, and increase our function within. So I give you this example with diabetes, primary prevention. So what we're going to do with our healthy people, now they have nothing, they don't have diabetes, they don't have anything. It's our healthy community. So we're going to be giving healthy diet and exercise plans that will prevent diabetes onset in the future. So the goal there is so that they don't get type 2 diabetes with obesity as one of its prime things. Okay, then when we're at our secondary, if anybody's gone for a well visit, they usually do this at every well visit. If you're not diabetic, they'll do a blood glucose screening. And then we identify if elevated blood sugars, and then they may do something like a hemoglobin A1C to see where it's been running. And then we have our tertiary where we use medicines to treat our diabetes in hope of decreasing the onset and severity. So for example, we're going to teach our diabetic patients how to use their new insulin pumps. Okay, so that would be at tertiary because we're already there. So the mnemonic that I like to use, and I use this a lot throughout teaching, is our primary is prevention, secondary is screening, and tertiary is going to be treatment. Okay, so we're going to think about that whenever we're looking at something. I will tell you there will be questions like, what is an example of secondary, secondary prevention? So what I'm going to do with us now is we're going to do a little Kahoot so that we can all go over our primary, secondary, and tertiary preventions. And that way I want you to get really comfortable with it. Okay, so everybody know how to do a Kahoot? Yes, no, maybe so. We should at this point. Everybody's done Kahoots. All right, so here we go. We're going to do a Kahoot together, and it'll be primary, secondary, and tertiary. Kahoot, here we go. Okay, so I'm going to start it. Everybody should be on Kahoot it. And then you're going to put in our code, which in 1 second. It's loading, but I don't like the way it looks like it's loading, so we might have to stop and restart. Oh, no, this is good. All right, we're gonna play our classic mode. Come on.
I've never used it before. How do I find you on it?
Okay, so what you're gonna do is I'm gonna stop sharing for a second, and because sometimes it takes a little while longer if I'm sharing the screen. Okay, so what you're going to do is you're gonna go to Kahoot it. And then it'll ask you for a code. Okay, so our pin on Kahoot it, Stephen, are you on Kahoot it? You just go on your page.
Yeah, I'm on it now.
Okay, hold on, and now. I'm gonna go on our Kahoot, and the code is going to be. Where did it go? It's hiding on me. Hold on just a second, guys. There it is. Okay, so our pin, and what it will do is it'll maximize it at 10 people. Kahoot has changed for some reason. I don't know why they keep doing this, but they change it all the time. So if you're not able to log on, what I want you to do is I want you to play at home. You're putting your pin in 6760503. You can also scan that barcode if you want to do it on your phone, but it maxes us out now with 10 for some silly reason. But we will play this one. We're not going to do all the questions, but I think we'll do some. Any questions on what we're doing? All right, we're gonna start. Well, it looks like it's letting us do more than. Okay, here we go. All right, define primary prevention, and our choices are actions that prevent the occurrence, actions to reduce the occurrence, screening to identify diseases, and managing disease post-diagnosis. Oh, it looks like it's letting us do more than 10. That's good. All right, good. So on our primary, what we want to think about is P&P. So we're preventing disease process. 3 of us picked screening. And remember, of the 13 who picked primary correctly, what is screening? Which level is that?
Secondary.
Very good. Yep. S&S, secondary. Good. Okay. And here we go. This level of prevention is a primary. Nursing assessments and care in a home, teaching a client in rehab, encouraging regular medical checkups or Hep B vaccine. I was wondering if this was going to happen. Okay, so for somebody who picked green, you guys aren't on screen, we can't see you. Tell us why you thought encourage regular medical checkups is going to be a primary prevention. Nobody wants to say why?
I mean, the time ran out and I couldn't pick, but I would think because it would prevent, like if you have a regular checkup, therefore, if there's anything that rises, like in your blood work or anything that you can prevent it.
Okay, so that would actually be secondary, what you're talking about. Good, screening and all that, that's good. I like the way you're thinking though. So what we want to remember with our primary prevention, one of our key things, all of us should have this, our Hep B vaccine, right? Why are we giving vaccines in the first place? What's the point of a vaccine?
To prevent disease.
Yep. So out of our 2 choices here, encourage regular medical checkups. It's fine to encourage them, but our best answer here is our vaccinations because we know that that will prevent. We can encourage regular medical checkups, but what else would we have to do in order for it to be a primary?
Teach.
Yeah, you want to teach them why they're going to go to those medical checkups. Good. What else? If we just say, go to your medical checkup, anybody who works in healthcare knows what? What do a lot of people do?
They don't.
Go.
Exactly. They don't go. They say, oh, yeah, I'll go. And then they never go, right? All right. So with our primary prevention, we really think about vaccines because that's the prevention of illness there. Here's another what's primary. We'll skip this one because we just did this. All right. Self-breast exams would be considered which level of prevention? Primary, secondary, primary, and secondary. Ooh, well, all over the board here. Someone who picked secondary, which is the correct answer, tell me what you were thinking, because you're right.
Because you're
It's the
screening.
screening.
Yep. Exactly. You're screening, right? If it were primary, what would you do as far as a self-breast exam? What are you going to do to your patients to make it primary?
Teach them how to do the breast exam.
Or teach them that there's stuff you could do. Very good. There's stuff you could do that will help to prevent. But then we need to go to our screening or our secondary, okay? Very good. You guys were split on primary and secondary on that one. So just remember, self-exams, you're screening yourself. Chemotherapy for cancer is which level? Primary, secondary, tertiary, primary, and tertiary. Yes, good work. Everybody got that, and why is that tertiary?
It's treatment.
Yep, TNT, very good. All right, let's take a look at our next one. Secondary level of prevention, let's skip that one. We kind of know that. This is an example of primary prevention. The use of seatbelts, rehab services, getting treatment for stage 4 or support groups for addictive substances. Awesome. 16 of us picked seatbelts. And why is that? Because the use of seatbelts is going to do what?
Prevent injury.
Prevent injury, prevent musculoskeletal issues, prevent broken bones, all those kind of things, right? Treatment would be what phase here? Getting treatment?
Tertiary.
Good, T for T. Rehab services for post-surgery patients.
Is that tertiary as well?
Good, Jen, why is it tertiary?
Because it's rehabs, it's like a type of treatment.
Yeah, and they already have a problem, right? They're
Yeah.
post-surgery. And then we have support groups for additive substances. Why is this tertiary?
They already have the addicted. Addiction is a disease, so they already have it.
Very good. So you're going to see in tertiary a lot of support groups, a lot of rehab groups. That's a good clue when you see that word for tertiary. All right, we're doing well here. Let's see. RN is implementing a tertiary prevention strategy for pesticide. Which activity would she complete? Treat a client who has pesticide exposure, teach farm workers how to recognize, observe farm workers, and provide teaching on how to handle pesticides. Excellent. It has the word in there that we should be looking for when we see tertiary. And what is that word?
Treat.
Yep. So teaching would be what, teaching, if you're teaching them how to recognize signs and symptoms, what level would that be?
Primary.
Excellent. Any teaching is going to be primary because you're trying to educate before they do anything. Like you're trying to give them immunizations to prevent. Good work, guys. All right, so we'll do 2 more. RN advises a client with osteoporosis to have 3 servings of milk daily. What level of prevention is this? Primary, secondary, treatment, but not prevention, tertiary. Oh, we only had 2 there. If you're teaching a client with osteoporosis to have 3 servings of milk, what do we know the client has already?
Osteoporosis.
They already have osteoporosis, which would be the disease.
Yep.
Okay, that was a trick.
So it's the, I'm glad you said that. But so what you want to do is you want to read in your context too. If a client has something, you already know you're at tertiary, right? Because if they don't have it, the whole point of primary and secondary is to prevent these things from occurring and identify early on. This one already has it. So that was a good one though. I'm glad you guys, we went only 2 on that one. What are we going to do during a pandemic for tertiary prevention? We just lived through a pandemic. Identify designated screening sites, organize a vaccine clinic, implement home care visits for medication for COVID clients, or coordinate education on prevention. Remember, we're doing tertiary here. Very good. And why are we doing home visits for med administration? Why is that our right answer? Because it is.
Because they already have COVID.
Yep. Very good. Vaccine clinic is going to be what?
Primary.
Yep.
Primary.
Yep, primary. Good. And then coordinate education. Education is going to be what?
The primary.
Yep. Good. And then identify designated screening sites. It has the word right in there, so you know that's our secondary. Let's try one more. Oh my, sorry, the spelling. What's included in the secondary prevention? Medicine, rehab, vaccines, or screening? Excellent. What would medicine be?
Tertiary.
Tertiary because we're treating. What would vaccines be?
Primary.
Absolutely. And rehab would be what?
Tertiary.
Yep, because you're treating. Good. All right, I'm going to stop right there on the Kahoot. So does everybody understand the difference between the 3 and how they kind of overlap? If you have the condition and you're treating it, it's tertiary. If you're screening for it or you see early signs of something, you're going to be a secondary, and primary is going to be our vaccines. We're going to be giving vaccines out like we did during COVID to try to prevent that, right? Okay, guys, just a reminder, please have your cameras on because I will tell you that your Zoom is showing that you guys don't have them on. Any other questions on primary, secondary, and tertiary?
I have 2 screens because my phone.
Okay, I'm muting you on the one. Yeah, I see you, Jen. Shanice, I don't see you on camera. So I need you to join on camera, or then you have to go to the waiting room and then it does all kinds of stuff. So please make sure. Just as a review, our attendance policy has changed this quarter. Does somebody want to tell us, just remind us? Camilla, you want to remind us what our attendance policy is?
That you have to be on the screen at all times.
Good. Tell me what else. Classmates, help her out.
Can't work or be driving or a passenger in a car.
it can't be blurred out in the back.
Good. Anything else? Mary's laughing, so she must have something good. Are you
No,
laughing at
I was
something else?
laughing at Alvera because her face, when you said blurred camera, like her face was like, whoop.
I
No,
don't
it's
know
okay.
how to
I-
do
guys,
it.
I have mine blurred and I shouldn't have mine, so let me change mine right now.
Well, how do you do that again?
You just click on the little dots. I'll do it for you. Oh, it won't let me do it. Click on your dots in your corner. See where in your little box? click the three dots and it'll give you a choice to unblur my background. All right, so what we're gonna do from here on is what we're going to be doing is we're gonna be taking a case study apart and we're gonna be covering some of the content that we covered during this week. And so I'm gonna split you up into groups. We're gonna take a look at this case study. And let's take a look at it. Here we go. All right, here's our case. Can everybody see it? Yeah, okay. Here's our case study. You're a nurse at a local hospital in an urban area. In the past month, you have discharged the following 10 clients between the age of 23 and 35. 3 Latino males, 2 African Americans, females, 1 American Indian female, 2 Filipino males, 1 Caucasian male, 1 Caucasian female. This has you concerned. You review your discharge planning for the population of this young adults. All right, so we have a couple questions that we're going to look at. I'm going to break you guys out into our Jamboard, and you're going to each have a group, and you're going to take a look at this. I'm going to actually put, if it'll let me, I'm going to put the case study into your chat, if it'll let me highlight. There we go. And you guys are going to be answering some questions, and I want you to pull some of the information that you worked with this week in your reading, in your lectures, to help you answer those questions. Okay, so we're going to go to our Jamboard. Everybody remember how to do Jamboards? Sort of.
Honestly, I do not.
Okay, no worries. No worries. So what we're going to do is I'm going to give you a website, and you're going to go to that website. And what you're going to do is you are going to be able to add stuff in, and I have put questions on every page, so I'll share with you guys in a second. Hold on. Okay, so for example, here's our Jamboard. You know the case scenario. And this is what our Jamboard looks like. So you're going to be broken into 5 groups. And you're going to be answering these questions. Remember, on the left-hand side, you have sticky notes. So if you want to type stuff in, you can. But when we come back together as a class, we're all going to share what we came up with. So one group's going to do what are risk factors. Oops. One's going to talk about primary, secondary, and tertiary prevention and how this applies. One group is going to do Healthy People 2030 and what it says about type 2 diabetes and how we use this information with discharge with our clients. And how does cultural competency play a part in this? And how are we going to present it to the community? And then how do our 2 concepts of community-based and community-oriented nursing apply? Okay, so depending on your group will be your slide number. Okay, so I'm going to put in the chat here the link, and you guys are going to click on that. Okay. So everybody should click on that, and then I'm going to divvy you guys up into groups. Just randomly. Okay, so I want you to pull your information that we went over this week and last week about all the different topics and how we're going to apply those. Okay, with the group with Healthy People 2030, you can always use your textbook or our website, Healthy People 2030, to get our content. Okay, any questions on what we're doing? This is letting you guys apply the material from this week and last week into a case study, because what you will see on your NCLEX upcoming is you are going to have this. So that's why we as faculty are doing it this way this quarter.
Yeah, I don't know why this happened last week too, but I couldn't get into the Jamboard.
Do you have an Apple?
No.
Do you have Google?
Yeah.
All right, try it again. I'm going to post it again.
Okay.
And if anybody is in there and they can't get to the Jamboard, what I ask of you to do is just rely on your teammates. They can put in the post-it notes. Okay, but you guys will come back all as one, and we're going to discuss these different topics and how they relate to what we've done this week in our reading and our preparation. All right, any questions? No? Okay, here we go. So group one, you're doing slide one, group two, you're doing slide two, group three, you're doing slide three, so on and so on. All right, so let's split us up into our breakout rooms. We're gonna do 5 of them. And go, everybody off. Bridget, you should be going to your breakout room. I can't hear you.
It did this to me last time. The screen comes up, but then it doesn't allow me to go in. Every time I try to hit it, it won't go anywhere.
You should be joining in room 4.
Now the join thing is gone now. I had it. When I hit it, it disappeared.
Okay, I'm
Okay,
gonna move you to room 5 and see if you see
Okay.
it now. Hi there, you should have been in a breakout room.
Yeah, I had to unlog and log me out. So I was
Okay.
experiencing issues. I can hear you now better.
Okay, good. So I'm gonna put you in room 3 then, okay?
Okay, thank you.
You're welcome.
were the last two?
Yeah, they're all on there.
Okay, well,
Hi. What happened, Jen?
Oh, I'm still in the other room on my phone, but I had to
Okay.
reboot
Okay,
I had to
don't
reboot
worry.
my computer because it kept doing that stupid thing at the top.
Okay, don't worry. I just want to make sure you're okay.
Yeah, I'm okay. Still can't get in my classes, but I'm okay.
That's ridiculous, huh? And it was
They
all because
said-
of financial aid?
No, they said it was attendance actually. Like they said I hadn't been in attendance for 14 days. So they booted me out, but I'm like, I attended both my online classes last week. Like I attended your Tuesday and then my maternity on Friday. And then I also did my discussion for like maternity, like on Monday or Tuesday. So I have done stuff. But all
And
of
we
a
haven't
sudden,
really even had class for 14 days.
no, that's the
We've
other
only
thing.
had,
So,
right?
I didn't know.
That's weird. So what they used to do last, for the past couple quarters is they do these attestation thingies and you'd
Okay.
answer some questions
Yeah,
and then you get points for them.
right.
And if you didn't answer 2 in a row, then they would potentially drop you, but I don't know what's going on now. The attendance is a whole new thing, so I think everybody's learning, but unfortunately, in any learning process, people get really lost.
Yeah, well, that's why I sent you that email that
Yeah.
Dr. Cherry sent me because I can't even log on to my modules or anything.
Yeah, but you said something about a quiz. Don't worry, we don't have a quiz.
Oh, I thought we had a quiz tonight. I'm
No,
sorry.
we have our test next week. But
Okay,
no, we don't have a quiz. We don't have any quizzes in this class.
okay, all right.
So you
All
just
right.
have your assignments.
Okay, good.
Okay. All right, I'm joining room 4 and then we're gonna all come back together.
Okay, thank you.
Jennifer,
Anyway.
or
Go ahead,
Professor.
Jessica.
she's still on there.
She said she was going to group 4. She went off.
Yeah.
What's up? Was it for her?
No, I just didn't know. So like in maternity, when our professor like would post all the other professors like review sessions.
Yeah.
Will she do that, or is it she just like want us to log on to them and watch like live?
I don't know, but I heard that the one we have, Alani, is the best one to have
Okay.
because they
Well,
said
my
she,
thing is like in maternity, I never watched any of them live because my schedule's too crazy.
yeah,
So like when I go back and I watch them, like when they're reviewed, I can pause, I can take notes, I can rewind, like
that's true.
so. We
Yeah.
didn't have to watch one. We just had to do like the recording.
Okay.
So I guess that's something we need to ask. I don't know what we're supposed to
Yeah. I couldn't even see, I can't see any of my online stuff at all right now. So I didn't know what she wanted to do tonight. And for some reason, I thought we had a quiz.
do. I have one in peds, and then I have one in mental health later on in the week.
Okay. Yeah, I was gonna say, I thought week 2 was quiz week and then week 3 is exam week.
Yeah, I didn't see any quizzes noted for this class.
Yeah, she just, I don't know if you heard her, but she just said that we don't have any.
Yeah. Not complaining.
Yeah, you were in my maternity with Tess, weren't you, Tessa?
Do what?
You were in my maternity with Tessa, weren't you?
Yeah.
Yeah, I dropped that, because I didn't do well in the first 2 tests, so I dropped it. And I'm retaking it this semester, but I have a completely different instructor and she's
Who do you have?
Perkonovich or something.
So I was told by another girl to always watch McBride's reviews.
Yes, that's what I heard too.
And she's the only one reviews that I watched, and I passed every single one of my exams.
Okay.
So McBride was the only one I kept up.
Okay. I will do that this semester.
She's really like thorough. She
Okay.
explains stuff.
In
Like, she's
my,
not in a hurry and just reads off of a PowerPoint.
okay, in my Med Surg 2 class, a girl had community already and she said Alani's the best to have to watch hers because she does like quiz question reviews.
Okay.
So I guess we got the good one.
I was told to watch McBride and maternity, and that's who I watched all last term. So
Okay, I will,
keep up with her.
okay. As long as they get me in back tomorrow.
So my campus screwed me. I was the only one that passed my med surg class. I take evening classes.
Yeah, me too.
I'm the only one that passed my med surg class. So then when it came to med surg 2, they didn't offer it for evenings and tried to put me in a morning class.
So what are you doing?
I had to drop it
You're kidding.
because I work full time during the day.
Well, that's not
So
fair.
I dropped it and picked up my mental health.
So you won't have to take mental health next term.
No,
But-
but it still pushed me 3 months out.
I was gonna say it probably did because don't you take mental health with capstone?
Yeah, at the end. But I have to take med surg 2 before I can go into capstone.
See, that's not fair to you. That's
I was like, so I'm getting punished for passing a class.
right, exactly.
That's what happened.
That's not right.
So I only have like 3 online classes this term. Next term will be leadership in med surg 2, and then I'll sit with capstone by itself.
Oh God. Well, I guess that's not so
So it
bad.
kind of worked out in my favor.
Yeah, well, that's what is happening to me this semester. I just have the 2 online classes. I have maternity and community. They wouldn't let me do med surg, which I don't understand. Because I passed med surg.
I don't know why they wouldn't let you. Unless they want you to, I don't know why you would have to complete maternity in order to go to med surg.
But yeah, that's what I didn't understand either.
Doesn't make sense.
But it gives me a semester off of clinicals.
Yeah. I have clinicals on Friday, but only for like 3 Fridays
Oh, is that for peds?
for mental health.
For mental health.
Peds, we have simulation. We don't even have a clinical for it.
That's right. It's just for med surge is the clinical. Is there a clinical for capstone? Okay.
I know when I went to Fortis for my LPN, and when I had my capstone for my LPN, we had 12-hour clinicals,
Okay.
and we were at a nursing home, but you never know.
Yeah.
I feel like it's completely different this go around from my RN, so I don't know.
Is it better for you now?
I just have a lot more online classes.
Yeah.
So like for like maternity, peds, mental health, all of those were an on-campus class. So, and then I had a clinical for maternity, I had a clinical for peds, and I don't have them this time.
Yeah, I'm not minding the break this semester, but I'm hoping it's not gonna like make me slack off. Class is only till 7:30, isn't it? 7:30.
Yeah, I know if we're supposed to like go back to the
Well,
whole class or stay here.
when I met with her, she said that she had to go join group 4 for a little bit, so, and I'm on my computer on the other one and she hasn't sent anybody back, so let's just stay in our group out room.
Okay, cool. Well, I'm gonna go sit on my couch for a minute and I'll come back when it's out.
You got a big balloon in the back. Is it 7?
Yes, my son just turned 7 on the 9th.
Oh,
Those big balloons take forever to go down, so we just there until they deflate all the way.
that's cute.
Thanks.
I think somebody's posting on our board.
Somebody's posting it, it's probably group 4 because they probably didn't know. I'm gonna make sure to take that March 2nd. Okay.
There's 3 right here on the edge that are not ours.
Teaching, that's probably under that primary, tertiary, secondary. It's supposed to be under that one, I bet,
We're going.
which
we're
was
meeting
slide
with
2.
that room.
Oh, we're going back.
We're going back, coming back.
Come on back. Let me sign off on this one. Why is it still doing that on my screen?
Just for fun.
Okay. I rebooted my computer and everything.
Yeah, it's okay, don't worry about it.
Okay, as long as it's not bothering anybody, I don't.
Well, it probably is bothering, but don't worry. We're trying not to pay attention. All right, so we're all coming back, and what I hope we all are seeing is that all of these questions have a big chunk of what we prepared for this week and in our reading and our information content. So we're gonna have each group present like, just your main points. Let's share our Jamboard with everybody. And I'll just call on you and you're gonna tell me a little bit about other things and I'm gonna help guide you on things that we should have covered in our reading and our lecture. All right, what are risk factors concern you as a community nurse with our group?
Well, we came up with a select few things. Guess the first one would be healthy child development was one of them. That was in chapter 3.
Okay, and why do you think this had to do with your clients?
I guess if I can say this right, I believe our unhealthy eating habits start when we're young. So if we're not getting the proper nutrition as young kids, when we get older, we probably won't be eating healthy at all.
All right, so you're concerned about them as kids. Okay, good. Go ahead. What else?
Education.
What's a risk factor related to education? Tell us about that.
Nutrition and the pathophysiology of the disease itself, as well as risk factors, which is the modifiable and non-modifiable factors that can contribute to it.
Okay, what is making these people more vulnerable?
Culture.
Why do you think culture? Mary, you're not on your own. You have a whole group that can help you. Help her out here. What are we looking at here that risk factors? I like some of the stuff that you guys have up here, like genetics, like culture. I think you're focusing there a little bit. We did a whole chapter on genetics. What did you guys find out about genetics?
They're not modifiable. It's kind of like what's passed down to us. We can try to like reduce our chances of getting it, but it still makes our risk factors higher.
Good, and we
So-
use this thing called the genogram, very good, which is gonna be our genetic components, right?
Yeah.
So you draw a little picture, you have grandma and grandpa at the top, and then this one has this, and this is this. And what you will see, and there's a ton of research out there right now on that, very good, on genetics and how that makes them more vulnerable. What other kind of risk factors are you think are gonna put them in the position that they're in?
So we also talked about being like in their younger 20s, like your young adults, like they are just starting out their life. More than likely, they're probably in college, so they don't have that much funds to eat healthy. Or if they live in like a college or a dorm or something, they don't have like the proper stuff to make nutritional meals. So they're eating fast food because they're always on the go.
All right, Jessica, good. And she's touching on a couple topics that I'm gonna just pull together a little bit. How about our education level? We're looking at our social determinants of health here. What are we worried about? If it's a low education, if their education is low, what do we know they are at higher risk of?
Not having health screenings or inadequate health care.
So you actually see a higher rate of chronic disease process. Yep, our social determinants of health. What else is our living arrangement? She spoke about that. Depends on where they're living. How about their job? How about their languages? Is that maybe impacting them? Is that putting them at higher risk for having all of these types of conditions? Absolutely. All right, good work, group 1. Number 2, primary, secondary, and tertiary, and how would this apply?
For primary, we went with vaccines because when they have diabetes, they're going to be at higher risk of different diseases. We focus more on the flu and COVID vaccines.
Okay, and why is that?
Those are just the yearly things that go, well, COVID's not so much yearly, but flu is. Flu changes all the time.
Good, and in our group, we talked about primary is once you have a disease process like the people we're discharging, we're gonna have to do our primary prevention of other conditions, right? Because they already have the diabetes. So be real careful with that, and that was like the one with the osteoporosis, right? And how you're teaching to them, but by the time they have osteoporosis, too late. All right, tell us about your secondary.
Routine eye screenings. Eye
Yep.
eye exams.
And she says retinopathy exams are good. Checking A1C is good. We're doing our screenings to see how they're doing once they're discharged, right? All right, and then how about our tertiary? What are we going to be doing?
So for so for our treatment, we're gonna be making sure that they take their medication, like their insulin.
So how are you going to make sure that that's happening?
So we're going to make sure that they get the proper teaching. We're gonna make sure that they know how to use a glucometer. We're gonna make sure that they know if they have a pen, how to clean it before they apply the cap, how to turn it to whatever. So if they're getting 2, 5, or 4, we're gonna teach to make sure that if they're on a sliding scale, how to check their blood sugar before and after they eat and what their sliding scale is going to be. We're also going to, I know when you came into our group, we was talking about the family being involved as well. We're going to make sure that they know the signs and symptoms of hypoglycemia, what to do. We're also going to make sure that they keep their appointments. And as far as treatment goes, we're going to also make sure that the age group you gave us was like 25. And I believe making sure that they stick with their diet and things like that.
Okay, and that's very good. We're not going to spend a lot of time on teaching. We will spend a whole chapter on educating and how to best do that. But good, you'd want to see them do it, okay? You don't want them just to report it, right? You want to have them teach it back to you and show you how to do it. Good. Healthy People 2030, what does it tell us about diabetes? This group spent some time on Healthy People 2030 website, which was our assignment from week 1, and tell us what you guys found.
All right, so I'm going to start first and then I'll let some of the other group jump in. I think we're very well on this. The first basic one for Healthy People 2030 was the first objective was that they wanted to reduce the annual number of cases of diagnosis of diabetes population. And the reason is because it's the 7th leading cause of death here in the United States. And one of the things that they have found that those who participated in pre-diabetic programs, that it reduced, if they made these modifiable changes, diet, exercise, these things that we have up here, that it would give a lower risk of them actually developing diabetes.
Okay, good. How were you going to use your Healthy People 2030 information with your discharge instructions?
So on the Healthy People website, it showed that only about half of people that are diagnosed with diabetes receive a formal education on how to manage it and treat it. So we definitely want to make sure that we can increase that number, because that means literally half the people don't know what to do.
Good.
That's kind of scary.
And what is our goal with Healthy People 2030 and type 2 diabetics?
Educate people,
Yeah, we want to educate. What do we want to reduce?
the proportion of people that get diabetic.
Well, yeah, but now that they have it, what do we want to reduce?
Their A1C, they've shown that has been on the rise. A lot of individuals actually don't know that they have uncontrollable or that is out of the normal range. And so when they go, they're very surprised. So they want people to actually do some of those things, to go to have regular checkups, so that secondary intervention of what we've been talking about will be a good place for those individuals who already have diabetes, that they go to their regular checkups as their doctors or healthcare provider has informed them to do, so they can get those A1Cs checked every 3 months or whatever. See
Good.
what has
And
been running
remember,
for
what
us.
is our goal at Healthy People 2030? Generally, not just for diabetics.
So, I'm not going to dominate this. I know you want
Somebody else
everybody
from
to have
that group. What is our goal of Healthy People 2030? Or somebody from any group? This was in our reading. What is our goal? For Healthy People?
Reducing the diabetes cases, the complications, and the deaths that come from diabetes.
All right, so generally, what are we looking at with Healthy People 2030 over all conditions?
Decreasing morbidity and mortality
Decrease.
Yep, and we're trying to get people what?
to be healthy.
Yeah, to be healthier, exactly. Says it right in there, Healthy People 2030. All right, group number 4, how would cultural competency play a part? And we talked with cultural competency a bit about chapters 20, 21, 22, all about families and family risks and how that plays a part when we are doing our cultural competency. Tell us a little bit about it.
So yeah, we were definitely not on the right track initially, but hopefully we added some things that made a little more sense. But essentially, what the family dynamic looks like. So are they engaged, not engaged with each other? People with more dysfunctional type of family style probably have a higher increase in diseases, or not diseases, but getting help me out here, what's the
Yeah, you're
term?
right. It's chronic illness. You're right.
Chronic illness.
Yeah.
Same thing with if they're coming from a lower socioeconomic level, having certain resources, the less resources, the higher the increase of chronic illnesses.
Right,
Same
those are our
thing.
social determinants of health. Good.
Same thing with the education level, less education they have, the less opportunity they have to learning about certain chronic illnesses, as well as seeking the right type of resources for
Right,
managing.
going to appointments, think about those people who don't drive, how are they getting there?
Yeah.
Those kind of
Right.
things. When we go to the home and we are doing home visits, what are some things we're gonna do as nurses to keep ourselves safe?
Be aware of the area that you're in. Look and see how the house looks. Is it a mess? Is there safety issues with, fire alarms? Is the stove on, like you said, when you popped into our group, like, is the stove on, nothing's on it? Is the fridge working?
Is there food in the fridge?
Good, but I want you guys to focus a little bit, and this was in home visit something chapter, I don't know. And it has something to do with our safety as nurses. What are we going to make sure we do when we're in a home?
Following, oh, this is not safety.
You
That was
always
more-
have a way out.
Very good, Jessica. You always have a way out. You sit close to the door. What else do you
like
do?
more like PPE wise?
No, pretty general. Because we don't know what's in the home or what they have. So what else do you worry about? You have a way out. Who else are you gonna let know that you got there?
A supervisor or somebody that you
Mhm.
got
Your
there and you left.
organization, yeah, that you know you got there. Are you gonna wear your latest jewelry and your
No, so
iWatch
plain
and
Jane.
yeah, plain Jane. You go in there, you're not gonna be wearing any kind of clothing that looks like it may be
expensive.
expensive or not professional, right? We are presenting as professionals and that's what we are. What kind of biases do we worry about in homes? What biases as nurses do we have to be cautious of?
I don't know. I feel like-
Cultural?
Could be cultural. Maybe
Like their
they do
family-
something we're not used to doing. What else?
I was gonna say like their family makeup, whether it's like
Yeah,
a
blended or
heterosexual
extended.
couple or
Yep, I can tell you did your reading. Very good. That's right. You're looking at the different type of family. You're looking at what goes on in the household. You're looking at those kind of things, okay? All this has to do with your home visit. Your biases as a nurse, you're always gonna have your own opinions. What you need to do is you go into that home and you present as a professional and put your biases aside. This speaks to our culture competency, which is something as nurses we will continue to work through for the rest of our lives, because that is not something we ever have and we're done, right? So we talked about that in this group as well. And then community-based and community-oriented. Come on, group, you guys did well. Let's hear this.
Okay, so we started off a little rough as well, but we were able to break it down in a way that oriented community nursing is more of a wellness and preventative type of nursing. as opposed to like community-based nursing is more focused on the illness. So like taking their meds or like more focused on how to maintain the illness. We thought about it, and if I don't know if that's correct, but like we thought about it about like, so based is mainly like tertiary and oriented is like primary. I don't know if that's
Okay.
really correct.
So I
but
want to
that's what-
focus you guys for 1 second. Thank you. I know this group did, you guys did well, and it was a little hard. This was our first case study. We'll probably do case studies every class. So I want this to be a learning experience. Everybody did amazing. So I will tell you, you guys all participated and I appreciate that. I'm going to show you this slide and I need you guys to really focus on this content. So your community-based nursing is going to be our focus on that illness care of individuals and families. When we look at community-oriented, we're looking at quality of life. We're looking at healthy. We're looking at public health nursing. What can we do to promote, restore, protect our populations? Okay, so they're very different things. One is our base nursing, and what we're coming more into content with as nurses in the community are community-oriented nursing. Just like we're looking at Healthy People 2030, we're trying to get people on the healthy spectrum as opposed to the illness spectrum. And now this is a little different from when you're taking med-surg and they're just teaching you all the conditions and how to fix it, right? But as community nurses, it is our job to go out there and to teach the community to help to promote the quality of life. Okay, so we're going to see much more community-oriented nursing, while oftentimes we think of when we do home health care and things like that, we look at illness care. But I really want you to know that there's two separate things and they're going to be very, very specific. Okay, sorry. Keep going there. You guys were doing good. I just wanted to make sure we know the differences.
So basically like an example of community oriented would be like a school nurse holding a class, teaching kids how to wash their hands appropriately. So that's kind of like, you know, prevention of different, you know, germs and stuff like that. Like I said, I work at a facility and we'll have a nurse come out and she'll hold kind of like a class teaching, you know, healthy eating, exercising, and, you know, portion size and different stuff like that. So that can be another example.
Good. And so when we do our community base, we're going to be focusing on our illnesses, right? And so we're going to be taking care of those people that we know are ill. All right. So those are two key concepts that were in chapter 1 that I do want you guys to know about. We are at 5:24, 7:24. So I'm not going to give you guys a break. We'll end in 10 minutes. But what I want you to do is we're going to take a little further look at some questions I have about this case scenario and some things that we're going to focus on. So I'm going to share a screen with you. And in the chat, I want you to write your answers and then we'll go over them. Where's my thingy? Any questions for what we've gone through so far? What I will tell you is important is our preparation for each week. And that is because the content is going to be applied like it was tonight. And you guys did a great job with that. You pulled some of that data that you had learned over the week or had listened to in lecture or reading or whatever, and you applied that where you needed it. And so that was excellent. I'm trying to pull this up. Let's see, why is this not pulling up? Oh, here it is. Come on. I sometimes have a hard time when I'm sharing my screens because I have so many open. Let me see here if I can. Let's actually take a look at another case study. Let's do that. And it's going to focus us a little bit on stuff that we have done in our different chapters. So let's take a look. Oopsie. Let's take a look at this case study here. Can everyone see it? I'm going to move it up. Come on. All right, here's our case study. I will enlarge it so you guys can see it a little better. All right, somebody want to read the study?
Does anybody else see it?
I don't see it.
I
don't see one.
Still see the
I
jam.
don't see that.
All right, hold on. All right, you guys see it now?
Yeah.
All right, who wants to read the first paragraph for us? Oops.
Jamie Lee.
Go ahead, anybody go.
Jamie Lee is the occupational health nurse at the T-shirt factory in town. Recently, the health clinic at the factory had budget cuts, resulting in the reduction of services and personnel. The once full-time clinic is now open only 3 days a week, and Mrs. Lee no longer has support staff to help her with her paperwork responsibilities.
All right, next one.
From her interactions with the workers, Ms. Lee has observed several risky health behaviors. For example, unhealthy diets, smoking, sedentary lifestyles among the workers. Although she is very busy in the clinic, Ms. Lee would like to develop a health promotion program to address these risky health behaviors, but she is not sure where to start.
Good. And so we're gonna go down and take a look. Here's our first question. And this was out of our chapter 9, our evidence-based practice. How can evidence-based practice help Miss Lee plan a successful program? Put some things in the chat and we'll see. How can she learn about current studies being done in occupational health promotion programs? Let's review evidence-based practice is what?
Providing care based off of research that has been proven to essentially help.
Okay, what do we know about that research? Is it a one-time thing?
No, it's been over a good amount of time essentially, and it's
Good.
ever
It's like
evolving.
ongoing, right?
Ongoing. What is that thing we call when we're looking at literature that's most effective for our health promotions? Starts with an S. This was in our reading and our lecture. What is it with evidence-based practice? What kind of studies are we looking at that are going to be most valid?
Statistics?
Is it the
Mm,
systematic
good call.
review?
Yippers. Very good, Dushana. Systematic reviews. What are those? Tell us about them.
So it's just like research from different libraries and like different how can I say it? Like
You're
just
right, different libraries, different sources, yeah, different writings, good. It's a combination and we look at all that and see what's the finding and they find a similar finding. Okay, Miss Lee would like to involve the employees in the development and implementation of her health promotion program. What is our best method of accomplishing this while using evidence-based practice? What do we need to do with our employees and our evidence-based practice?
Like educate them.
Yeah, but what do we have to be sensitive to?
The different cultures,
Yes,
Okay, different cultures, what else?
their
Languages.
backgrounds, education.
educational level. Mhm.
Yep, level,
Um,
language, education, how about preferences? Like maybe some people like to read and some people like to write and some people like to talk and some people like to draw, right?
Language barriers.
Yeah, language barriers for sure. Now we're involving our employees. So employees can be a spectrum, right? They can be all the way from, think about in the hospital, we have a spectrum of employees. So they can be anyone from, we used to call them environmental, to housekeeping, to laundry, to food services, to all this, right? So we're thinking about that and we want to identify what do the factory workers need here, which is who she's working with. What kind of things are they going to need? And are they going to be able to learn at all at the same level? No, right? Oop. Through her research, Mrs. Lee learns, I'm making it big again. Through her research, Ms. Lee learns that the most effective health promotion programs are those that include teaching and follow-up. What barriers might she find? What barriers are you going to find when you use evidence-based practice?
Like their education level.
Yep. What else are you going to worry about with evidence-based practice in a facility?
Sometimes they might not show up to their follow-up appointments.
Yeah, they might not show up to the follow-up. But what about the factory itself?
Resources.
Yeah, good. Tell me a little bit more. What do you mean resources?
So, I mean, I'm saying more so being able to follow up with, sorry, I just lost the question.
You may not have like, and are you talking about like maybe Professor Lyon, they may not have interpreters or write documents to explain actually what's going on. in
Okay,
particular
yes.
individual's language.
All of this though, all you guys are coming together, the same thing, right? When you have all this stuff going on in a factory, what do you need to get all these programs working? What do you need for teaching and follow up and all that? What do you need? Yeah,
Being, yeah.
money. Right? You need money. Isn't that a barrier to evidence-based practice? Maybe they don't have the money. Maybe hospitals don't have the money for it. What's something else we might see?
I mean, we don't know what the follow-up looks like, so, I mean, essentially, like even just transportation, if they need to get somewhere.
All right, so these are workers, so you hope they're coming to work, but who's gonna do the follow-up? Are we
Yeah,
gonna
whether we're
hire somebody
shorted.
now to do follow-up? And so
Need
now
like
we're
a
gonna.
committee or something, or a team.
Right. Yeah, and so you're gonna put all that time and effort into training a team. Do you guys see where we're seeing these barriers in any community? This is a factory, but you guys know in hospitals, when they want to implement something new, does everybody stand around and say, yippee, let's get the new computer system? No. There's always barriers. I don't like computers. I don't like different things. I don't want to learn, right? Think of all these barriers. This is going to happen anywhere that you have evidence-based practice. It doesn't mean we don't try to implement it, right? But these are barriers we're going to see with our evidence-based practice. Is that pretty clear to everybody? All right, so this is just a way to put into effect what we did in our chapter 9 with our evidence-based practice. Okay. What else do we have out there? This week we have a discussion, right? Isn't that this week? Let me double check. We
Yes.
have homework. I had 2 people say they were late on the homework, but you weren't, so don't worry. As long as you get it in by midnight Eastern Standard Time, you're not late. Let's take a look at our module.
I do have a question.
Go ahead.
So for our exam for next
Yep.
week, and you want us to go to at least one review, correct?
Mhm.
Okay. Will you post the links for the recordings for the other ones?
Yes.
Okay.
So all recordings will be posted when I get them. So understand, as faculty, we share them. Sometimes we don't share them as quick as, you know what I mean? You're not going to have a recording done at 5 o'clock and I get it at 6 o'clock. But trust me, they will be out there. What I will do is put an announcement out there and I will add to that announcement as each new review pops up. So keep watching that announcement for your review sessions. There is attendance that will be taken. So make sure you guys put your name in the chat and our class. I will do a review tomorrow. I think I'm scheduled for tomorrow.
Yeah, I think it says 8, right?
8 Eastern Standard Time. Mhm. So 6 my time, 7 Central Time, 8 Eastern Time. There will be I do teach on a PowerPoint for your review. I will tell you the content I cover in the review you need to know. So if that will help you in any way, just know that. What else can I tell you? Make sure you attend a review. We were going to look at our assignments for this week. Please make sure you get everything in on time. You guys know that. But I had no problems this week. You guys are on target. Great work. I really enjoyed learning about each and every one of you and appreciate it. I'm almost done with all the professional development plans. They should be done by the morning. All right, so week 2, we have our discussion question. Like we said, you always have these review and then you have your NCLEX review questions as well. Okay, so that's for this week that we're in. And then next week we'll have our exam. Know your exam will be populated and it will say you can download your exam, usually 24 to 48 hours prior. So I need everybody to be on target. I need 2 forms of technology, a computer and a cell phone. Because you need to be on Zoom for one and take the test on the other. No calculators. And I don't know what else to tell you. Please go to the review sessions. Please keep up with the reading. I told you guys, you can't get behind on the reading. It's just too intense. So, any questions you guys have, please send me a note. Otherwise, we are done for the evening. You know, I usually like to give you a break, but I apologize. We were tied up most of the time, so we're getting 4 minutes here, 3
I
minutes
have a
now.
question about the group assignment.
Yep.
Are we getting, I guess, assigned a case study?
For that one, you can pick.
Okay, I wasn't sure.
Okay. I usually assign it, but I'll let you guys pick.
Okay.
Okay.
So Professor Lonnie, I'm new to your class this week.
Yes, yes.
So I sent your email to see what group. I'm
Yes, I
gonna
know.
be in.
Ghoul, what group were you in initially? He's not listening. Ghoul. Alrighty. The other one that I switched, Alvira, I switched you, didn't I? What group were you initially in? Do you remember?
5.
Okay, so Shanice is now joining up with group 5. Group 5, please stay on. We're gonna end class right now, but please stay on for just 1 minute, okay? All right, everybody, best of luck studying. I will see you next Tuesday. Take care. Well to you all.
Do you still need to know what group Ghoul was in? Oh, there he is.
It's okay. I think he tuned me out a while ago. It's okay.
I'm in group 1. I thought you said that in the beginning.
No, I was asking what group you were in, that you switched.
Oh,
Don't worry. Bye. Have a good night. You're okay. We got it. Thank you, Elvira. Oh, well, hey.
Where did they
That's
go?
the only one. Passion, you in group 5? I can't hear you.
Yes, me.
Yes.
I think her name was Chandrea.
I know. You know what's weird is I have this list for you guys, and I just didn't have it in front of me. So I thought if you guys just stay on, you could all exchange text numbers. But I don't know. Thanks for staying on, Passion.
You can give me your number real quick, and I can try to start up a chat.
That'd be awesome. Can you do that? All
Hi,
right, Shanice.
Passion.
Hi.
All right, Shani. So you just give your cell phone to her if you're comfortable with cell phone, and then you guys will text back and forth, and then I will send an email probably in the morning, just making sure the other members of the group are with it.
Okay, so Passion, you ready for it?
Yeah.
804
Mhm.
402
Mhm.
2145.
Okay.
And what is yours, Passion?
That's 330
330
459
459
4361.
4361.
Yeah.
Okay. And then we can text back and forth and see what the topic is and everything.
Yeah.
Yeah,
Okay.
you guys have a discussion question coming up, and it's a case study.
Is it due
And
this
so-
coming week?
The third week.
Yeah, the third week. So not this week, but next week.
During next week.
You stay on for a second though, because I just want to touch base with you since we haven't really touched base.
Okay.
Shanice.
Okay. All right. See.
You're good. Thanks,
Thank
Passion.
you, Passion.
All right, so were you part of another class or you're just late signing up?
Yes, no, I was with Professor Price at first.
Okay,
And
okay,
then Dr. Brown and Dean Brown
yeah,
and I talked, and so she allowed me to switch
Okay,
to this
yeah.
class.
no worries. Are you repeating this class?
No, ma'am.
Okay, so I just wanted to give you a heads up that I don't know why you switched and I don't want to know. It's not my business. What I will tell you is this is I feel you're kind of behind the 8 ball now because you were behind a week, but we'll catch you up. So what do I need to do to clarify for you or make easier for you? Or, you know, I will tell you, I don't know. All of us as faculty are teaching the same way this semester. So attendance is mandatory. Cameras have to be on. We have nothing to do with it. Zoom does a report and tells me when the camera's on and off. So if I see your camera's off, I have to put you into the waiting room because that's the way it works. I don't even know why. But so just so know for that on attendance, on late assignments too, I'm sure Professor Price went over this, but we can't accept late at all. So
You got mine on time, correct?
yeah.
Sure.
You said, I
Okay.
think you said, did it upload? And I answered you in the comment. I said, yeah, you did fine. It was good.
Okay.
Yours was very good.
Oh, thank you. Because
So
Dean Brown just wanted to make sure everything
Yeah.
crossed over, she said, to make sure I had access, yeah.
Yeah, you're good. As long as you have access to everything, then I'm fine with that. If there's anything that pops up along the way. Now, I do understand how you feel because your group project is due next week and you haven't had a group. But what I can tell you confidently is we really work week to week in this class because it's so heavy that we
Okay.
have to just stay week to week. So you will have another group assignment week 7.
Okay,
So no, it will be the same group of people.
okay,
Okay, week 9, you have a big assignment. It's a vulnerable population assignment. That's 6% of your grade. That's something that we will talk about probably beginning week 4, but just I'm giving you a heads up as to like my major things that I like to tell people. We're teaching very differently this quarter. I don't know if you've picked up on that, but we're not doing lecture. Our lectures will be done prior to class. So my lecture.
okay.
Mhm.
That's why I
So-
saw you put in lectures. Okay,
Yeah,
okay.
and so there will always be a lecture posted on your announcement. I need you to watch that. And I really I'm trying this quarter to follow with the PowerPoints because I feel like that gives us a flow and you don't want to just sit there and listen to me talk. And I don't really like teaching that way because I much more prefer interactive, but that's how we have to do it. So that's how we're doing it. So
I
just
picked up
watch
on that
those-
from you.
So
Yeah,
just pick up
today.
on your recordings and we're really trying to have like, active participation in classrooms. And by doing that, if you guys are prepared when you come, then you're prepared to come. No, for next week, exam number 1, watch my 2 lectures that covers the material. And go to one of the review sessions.
Yes, ma'am.
And I will, I'll have the recordings out there.
I'm a big person. I'm gonna tell you, if I have a question, I'm going to email you.
Yeah, please do. And I told them this last week too, this is the truth. I get about 50 emails a day from Fortis. So I just want you to know if I don't answer you and it's something like you need to know within like 24 hours, just text me. I'm on Mountain Standard Time. And so
Okay.
if I don't answer you because I'm sleeping, but I work daytime. So I go to bed at, whatever, 11 o'clock at night, Mountain Standard Time. So I will answer you as soon as I can.
Okay, I know I
Okay.
gotta fasten my pants, but I've been reading your emails
know,
and
no,
I got your in-depth study guide, so. thumbs up
I know
on
the
that.
study guide's
Yeah.
a lot. I know it is. But what I'll tell you is I'm going to really focus on my study reviews. I do that purposely because I know it's a ton of content and I know we have to focus a little bit. So the good thing is I will tell you is that SE rates are very high coming off of this class. So
Awesome. I'll
That's a
see you
positive thing.
tomorrow. I'll see you tomorrow then at 8 p.m.
okay. You don't have to
Thanks.
come and listen to me for another 2 hours, but I promise it'll only be an hour tomorrow. And
Okay.
I just want you to get comfortable and, used to what you need. And like I said, anything comes up with the group project, call me or text me or email me, whatever, and I'll take care of it.
I appreciate your person, Ilani. I
All
look
right.
forward to being in your class.
Oh, absolutely. Take care.
Take care. Good night.
Good night.